Wait, prone, no, supine, no, arm out. Okay, let's go. First, if you're ever curious what I use during my sessions, please check out rebelmassage.com, where I sell products that are made by a massage therapist, me, for you and the work that you do. They are real products made with real ingredients for real work. I'll include a link in the description below. Okay, now let's go. This is a part 2 of a video that has a part 1 that is all about the shoulder, the arm, and the hand, and the vague pain that we often feel that is not always diagnosable. In that video, I mainly focused on the muscles of the back and the posterior shoulder, and for this video, I've flipped my client supine. Okay, so if this is about the shoulder and the arm and the hand, why am I working on the neck? Because everything is connected in anatomy. I mean, everything's connected in general, but this is especially true underneath our skin. I don't think anybody's going to argue that the shoulder and the neck are inextricably linked. So if I can get the neck to give me the shoulder, I can get a little more work done. I talk a lot about friction in part 1 of this video because when a lot of bones and tissues converge in an area, there's a lot of connective tissue. And if there's a lot of connective tissue, friction is your best friend. I'm standing on the opposite side of the table from where I'm doing the work, and I'm using my palms to create friction and heat. I'm thinking about how overused these muscles commonly are, and when that happens, the fascia and connective tissue that surrounds them tends to bind. And if I can loosen this connective tissue, I can begin to dismantle what has such a grip on the shoulder that has taken control of the arm and the hand. In general, the more mobility a joint has, the less stability it has, and the pecs work really hard on keeping the shoulder stable. Maybe even too hard, I would argue. So much so that a lot of important vessels that help the arm feel good and do what it's supposed to do get stuck behind this wall of hard work and need a little help breaking through. As I compress down into the upper chest with a soft forearm, moving out laterally away from the sternum toward the shoulder, I'm asking my client to externally rotate her arm. So I'm not only creating a nice pin and stretch for the pec major, but I'm also gathering information. There are technically about 9 billion muscles responsible for moving the shoulder, so the more information I can gather around who's talking to who about what, the more I know who to target and how. PSM, by the way, have them move their arm into internal rotation as well because different movements equals more information. I recommend regrouping a little bit during your transition, connecting one side to the other, just to remind the parts that they don't work in isolation. I'm using my left hand here to sink down into the pecs and create some slack at their attachments at the front of the shoulder. With my right hand, I'm pulling friction back into the mix because this is definitely one of those areas where a lot of tissues converge and get very stuck. I'm asking her to join the party again by getting her to rotate her arm out and then back in again, sinking in through that thawed outer layer, getting down into those more sinewy components, and then frictioning again to keep everything fluid. Pain in the front of the arm can be so many things, so don't be shy about playing detective and being really detailed with your work. This next technique is one of my favorites. I'm using my left forearm to sink down into the upper pecs, and I've draped her right arm across her chest, and I'm asking her to hold on to her right arm with her left hand. I've also undraped the side of the table so that you can see what I'm doing, but this is only for demo purposes and not necessary in the actual work. I'm going to slide my right hand underneath her scapula, and with her arm in this position, her scapula is slightly abducted or protracted or moved away from the spine, so that when I compress down with my left arm and I push up with my hand that's between her scapula and the table, and her left arm is doing all the work so her right arm can let go, I'm creating this entire global experience for this shoulder that is going to be so effective and connect a lot of dots. The icing on the cake, of course, is always breath. So as I situate myself to do this technique one more time, I'm going to ask my client to take a nice big deep breath in, and as she exhales, I pull my right hand towards me, I compress down into the upper torso, I guide her breath out, and I help to release all of those vessels that are stuck in the crosshairs between the front of the shoulder and the back of the shoulder that are just trying to communicate to the hand. After a maneuver like that, I like to reintroduce the tissues to their newfound freedom. So I've walked over to the side of the table that I'm focused on. I'm using my right hand to manipulate what her right arm does and using my left hand to settle the scapula and all of its surrounding tissues back into place. Feel free to throw in a little trigger point therapy or extra friction here if the client feels like there's still something going on. Make this technique yours and cater your work to them. I pulled the arm up into this position in this video part 1, but I'm a huge fan of using similar approaches with the client in different positions because when you change a perspective, you change the way that work is received. So I'm using my left hand here to support my client's arm and reposition it as I move through the work, and I'm using my right palm and/or fingers to sink down into the anterior portion of the scapula and tissues that are related to it. Again, a lot of the work I'm doing in these videos is not about a specific dysfunction, but about freeing up the tissues so that the torso can communicate with the hand and vice versa. So in this position with the axillary area opened up, creating space around tissues that are normally shortened and allowing the passage of vessels that are normally restricted frees up a lot of tension and helps to manage a lot of pain that is often unidentifiable. I'm using my knee here, but feel free to use a towel or an actual bolster to rest your client's arm in this position so that you can use both hands to do the work that you're going to do. I want to grab her arm at the top of the deltoids, where all of these structures converge. In this position, your client's humerus will have a different relationship with the acromion process, basically where the top of the shoulder bone meets the arm bone. By softening these tissues, I can sink farther down into the structures and create a traction in multiple directions that can be a lot more effective. Side note, as I push down here, I'm not jamming the arm into the shoulder. I'm stabilizing the shoulder and working the scapula around the rib cage from this perspective. So I'm not just working the shoulder because the shoulder actually includes the scapula, which includes the rib cage, which includes the spine. So kind of getting everything. One of the most commonly dense collection of muscles is right here at the lateral border of the scapula. The teres major, teres minor, and latissimus dorsi, working with and around the subscapularis and the infraspinatus, become thick and stuck because we more commonly find ourselves with our arms at our sides than we do with them over our heads. Using your fingers or your palms create a little friction in here, or a lot of friction in here. Hold the arm in different positions, bring that friction all the way to the back of the scapula, down into the rib cage, pull that work up into the arm and into the front of the shoulder, connecting the points of work that you're doing to each other. There are really so many ways that a shoulder can go sideways, and even if we think we're making sense of it, it doesn't make sense. It can freeze, it can lock up, or it can just refuse to move in the direction you want it to move to. In any scenario, working with clients who have shoulders means working with clients who have really complicated parts. Take your time, be thorough, be detailed, wrap your focused work around the shoulder, and then make it whole again. No one likes the feeling of not being able to reach for something when they want it or hug someone when they want to. Bring this work all the way down into the arm and the hand, and if you want to check out how to do that, I've got a couple videos on that already, but also keep an eye out for part 3 of this series, because maybe I might have one, maybe.